The United States will now require all travelers coming from China to submit a negative COVID test beginning January 5th. Health officials have raised concerns about China underreporting coronavirus cases. Japan and India have also announced new measures to limit the number of Chinese travelers entering their countries to prevent the spread of COVID-19. For more, I'm joined by Dake Kang, a reporter for the Associated Press. Thanks for joining us.
Thanks so much for having me.
All right, so you've been in China covering the country's response to the COVID-19 pandemic. What is causing this huge uptick in cases there?
Yeah, I mean, basically, for the past 3 years, China has a very strict set of policies aimed at basically completely curbing the spread of the virus. So that was called the zero COVID policy. But basically, in late November, early December, the authorities suddenly pivoted and basically relaxed all of those measures, essentially scrapping all of the measures that they use to control the spread of the virus. And as you know, the virus is very infectious. So the moment they released those controls, the virus just started spreading everywhere. And people, for years, I didn't know anyone in China who had COVID. And it seemed like almost overnight, half the people I knew were getting sick.
Yeah, were you surprised, based on your knowledge of how things work there, by the fact that the government loosened those restrictions, sort of bowing to pressure?
Yeah, I think it was clear that there was some discussion about, the need for China to be exiting its zero COVID policy. I mean, it was really proving economically and socially unsustainable. The economic damage this policy was causing was really quite tremendous. Factories shutting down, entire cities getting locked down for weeks or even months on end. People were getting quite frustrated and upset, and there was quite a lot of talk of, immigration, and obviously there were, unprecedented protests in November. But I don't think anyone quite anticipated that, the pace of the policy change would quite be this fast. Before November, I think many people were thinking that these policies would stay in place for another year, maybe, or even longer.
Obviously, when the pandemic began, Chinese government officials were criticized by much of the world for a lack of transparency, which a lot of people believe led to the spread across the globe of COVID-19. And so now, are U.S. officials and Chinese officials communicating more than they have in the past?
That is a really great question, and one I would also love to know the answer to. The thing is, U.S. and Chinese officials actually have always been in a fair amount of communication on kind of scientific and public health matters. I mean, the U.S. and China have a very strong partnership on public health, dating back to when relations were better. Obviously, these days, it's quite a different story. Relations are obviously very poor. But I imagine that there is quite a bit of communication specifically on COVID, yes.
I'm wondering, based on the spread that you're seeing now, is the spread more rapid than it was at the beginning of the pandemic, or is that hard to tell at this point?
Oh, absolutely. I mean, we all know Omicron is the most infectious variant of COVID that has appeared so far. And the thing about COVID at the beginning, way back in Wuhan, I was actually in Wuhan at the beginning of the pandemic in 2020. But that was really contained largely to Wuhan. And the lockdown and the other harsh measures the government took were largely limited to that region of the country. But what's different now is the entire country is getting infected seemingly overnight. I mean, we're talking everywhere from Guangzhou and Shenzhen in the country south to Beijing, where I'm based. just the entire country, it feels like, has been getting infected seemingly overnight.
That is unfortunate. Dake Kang with the Associated Press, thank you very much for your time.
Thanks for having me. Really appreciate it.